All right. So Jeff, you don't have any audio. You're typing in there. You can't hear me now, so I'm going to have to tell you try calling in to the conference line. All right. So let's get into the actual PowerPoint here and talk a little bit about about what we're going to go through. Just as an overview, I want to talk to you, obviously, just give you a quick introduction as to who I am, why I'm giving the class, and try to give you as much information as I possibly can in about 90 minutes. That's a tough call, but try to do that, but I'm going to do the best I can. And then, of course, give you more information about where you can find more out about some of the stuff that's going on. I've got some new information for a lot of people, too, some good things coming up, some fairly exciting things that are on the verge here of happening. So we'll talk about that as well. So as to myself, my own introduction for those of you who don't know me, I run and own a survival school called the Human Path that is in Texas, near San Antonio. And for anybody who's on a conference call right now, can you please mute your line because you're coming through as I'm getting a lot of reverb and echo here. A little bit distracting. Thank you. All right, so my own background goes back to the military. I first got into medicine through Special Forces, through the military, U.S. Army Special Forces medic program, and that is a fairly intense medical program where I would say it's very likened to, say, a PA, a physician assistant, or maybe somebody on the conference call, please mute your line. There's a lot of static coming through. Thank you. At the time that I got into Special Forces medicine, which is very, very directed towards trauma, very directed towards working in an environment around people in a third world environment, fourth world environment, where there's really no supplies, I got into plant medicine as well. The two go together very well, and that's what I'm here to tell you. This is a big part of why I'm doing this, is that there is no question of the fact that we can use plant medicine in a post-disaster or remote environment very effectively. There are some things that it actually, in my opinion, does better than pharmaceuticals. There are some things it doesn't do nearly as well as pharmaceuticals. We, of course, can't do surgical or anything like that, and we're not saying that, but this is a chance. But there's a very large area. If you were to draw a Venn diagram of surgical and orthodox pharmaceutical medicine and herbal medicine, you would find a very large overlap across between the between the pharmaceutical and herbal medicine. And herbs work in a different way. It's not a one-for-one. You can't just say, if you're going to take this pharmaceutical, instead we're going to take this herb. It doesn't work that way at all. But you can get the job done, and in many ways you get the job done better because it's sustainable. It is something that is you don't have to worry about hoarding or rationing your supplies or anything like that. So when I give this class, why am I giving this class, and what's the perspective here? Well, the perspective that I want everybody to have is basically a two-part thing, and that perspective spans two different things. One of them is, as we can see here, from the standpoint of preparedness. So for preppers, and I know that's sometimes an overused and misused word, but basically people who are interested in being prepared for disaster, whether that is just a small disaster, a local disaster, or whether that's a national or even a full-scale global disaster. And so from that standpoint, and then the other standpoint is from the standpoint of the herbalist, from people who are really herbalists at heart. They're studying herbalism, they're studying plant medicine, and yet they want to have more of a practical, day-to-day kind of usage of herbs that they can pull out in both a clinical aspect or even just personally at home, to be able to use herbs in a very pragmatic way from day to day, for everything from minor injuries to even major injuries, to recovery from trauma or recovery from surgery, to chronic disease, of course, and maybe even want to be prepared for that situation where we're in the middle of nowhere, or we are in a post-disaster situation and there are no medications, and we have to be able to deal with a chronic illness. And many of us, have loved ones that have chronic illnesses, diabetes, COPD, asthma, things like that. So we'll get into that a little bit as well. So I'm going to get back up into the full slideshow here, so excuse me while we get back here. So this is two different standpoints that we're coming from here. And basically the prepper is generally in this for trying to figure out ways to be able to be independent and be self-sustainable. That's what we all want, and I think that is the key and the core of herbal medicine. That's why I constantly say it's the medicine of the people. It is a medicine that anybody can learn and practice and work on their own. And I'm not saying you can become an expert overnight or even in years. I've been studying herbs and working with herbs for over 25 years now, and every day I wake up and learn something new, and I feel like I'm starting all over. I mean, there are literally times where I feel like I know absolutely nothing. So it's a lot. There's no question. It's a lifetime study, and yet you can certainly become very efficient and very you can get good practical usage from herbal medicine in a short amount of time. I have a basic course that's designed just to do that. 70 hours, 70 class hours, and by the end of that you're fairly confident in being able to use a pretty wide array of herbs for practical usage at home. And then from the standpoint of the herbalist, again, being able to be more of a clinical herbalist in the sense that you're not necessarily working out of an office or something that you're even really accustomed to, but if life for some reason throws a big wrench in the cog, and you have a disaster, or you're trying to deal with something that's totally unexpected. As an herbalist, you can take those skills, you can take those tools that you have, and you can apply them now in a way that's very practical in a day-to-day type of life, and day-to-day life that includes even things like things that we would normally, for instance, medically, that we would go to the ER for, to an emergency room for. And really what this boils down to, honestly, is it comes down to the concept of the herbalist as a primary care provider. And that's a big step for most herbalists to take. It's huge. It's at that point, you're really stepping into an area where, first of all, there's a lot of legal ramifications from that. And, of course, that's out of the scope of today's talk. But you're never practicing medicine. You're never, of course, diagnosing and treating. We have to stay away from all of those buzzwords, those legal terminology words. But nonetheless, in a post-disaster or remote type of situation, if you're gearing up for that, then you are that primary care provider, really. And so what is that? I mean, what is that exactly? And so that's where I came up with the term herbal medic, because that's what a medic is. A medic in the military, and certainly a special forces medic, I had to be everything. I had to be the doctor. I had to be the nurse. I had to be the veterinarian sometimes. I had to be the counselor. I had to be all of those things wrapped into one for the immediate and for the follow-on care, and it could have been anywhere from 2 minutes to 2 months. You don't know. And so you have to be prepared to be able to be all of those things. And I think from an herbalist standpoint, if you can get into that mindset, it's going to make you a much more well-rounded and competent herbalist. So how we do this and how we pass this information, or how I want to try to get this information to you, is to try to talk through some of the integration of these two areas of basically what we would consider survival skills, but they're really not. They're really medical skills, and you'll see why. And then also the organization as to how we organize ourselves and how we organize the people that we work with. And before I get into that, and for some of you who've been through, there's a few of you probably online here who've been through some of my survival courses, and you've heard this term before, this concept before, the 4 A's of survival. And so for you, this is a repeat, but for the rest of you, you may be asking yourself what I'm even talking about here. How does this have anything to do with herbal medicine? Adaptability, awareness, attitude, and accountability. Well, it has a lot to do with herbal medicine. It has a lot to do with any kind of post-disaster medicine, or as we used to call it in my military days, we called it ditch medicine. That's basically what SF medicine was. It's, whatever you had to get the job done. If you go back to the 19th century, the eclectic herbalists, they were very much like that too. They used whatever they could to get the job done. They had to be adaptable. If you go back to this last century, to the beginning of the century, and you find the country doctors that would walk, basically visit. That was back in the days of country doctors making their rounds through different towns. And they had to be able to deal with anything. They were the epitome of the generalist, and that's unfortunately, generalism has pretty much died a sort of a silent and slow death in the world of modern orthodox medicine, because everything is specialized now. And so the generalists back in those days, they might have to fix a broken arm. They might have to deal with a case of tetanus, or deal with a whooping cough, or maybe help birth a calf. I mean, there was any number of things they would have to do, and that was the time where they really gave a person, I think it gave a person a much better, well-rounded look at what health is supposed to be, and made them better doctors. And I think the same thing is true of herbalists. It'll make you a better herbalist to look at every aspect that you could possibly look at as what I called earlier, that primary care almost, or the medic. Awareness is extremely important, and we'll get into this more when we start talking about the actual clinic organization and that kind of thing. Attitude is paramount. It doesn't matter how many skills you have. It doesn't matter how well trained you are. If you don't have the right attitude, especially in a post-disaster or remote environment where you're not in the first world, anything you want at the touch of your fingertips type of environment, the attitude, if you don't have the right attitude, then you're really worthless to the team. You're worthless to everybody around you because you can't actually get the job done. Attitude is really everything in every way that you can imagine in terms of survival and in terms of medicine, especially emergency medicine and especially in medicine in a remote or in an austere environment. And then accountability is just, that's an old medical concept as well. If you fess up, you have to be able to be honest with everybody and be honest with yourself, be honest with other people you're working with about what works as well as what doesn't work, as well as mistakes you may make. Everybody makes mistakes. The problem in medicine today, very unfortunate problem, is that everybody expects doctors and anybody who's practicing quote-unquote medicine to be perfect. And that includes anybody even in an unorthodox, non-practicing, non-licensed type of position like an herbalist as well. And naturopathic physicians, whether they're licensed or not, depending on what state they're in, same idea. If you have anything to do with the body, you're expected to be perfect and you're expected to be right all the time. And that's really a dangerous situation to be in because nobody is right all the time. In fact, most doctors and most people in the field of medicine are wrong a lot of the time. And it's not because they're incompetent or because they're untrained. It's because it's because it's a never-ending field of study. You'll never have all the answers. I've talked to docs who've been practicing in their field, in their specialty, like OBGYN or whatever it might be, for 15, 20, 30 years. And they always say, all of them say, it took them almost 15 years to the point where they could say they pretty much felt like they'd seen almost everything. And that was just in this country. You take them out of that and throw them into the Philippines after a typhoon, right, or into Haiti after an earthquake, or just into America after Hurricane Katrina, and there's a whole nother world. A great example was Haiti. Haiti, in post-earthquake Haiti, you had doctors, well-known and well-established orthosurgeons that were doing absolutely asinine things down there. They were putting on external fixation on open fractures and things like that, where there was absolutely no way. It was almost irresponsible, not because, if they had known what they were doing, it would have been irresponsible, but they just didn't know. You can't do that kind of that doesn't work in a post-disaster environment when there's no follow-up care, there's no hygiene. It's an entirely different environment. So my point is that, you have to be kind of open and accountable to whatever it is you're learning, and that's how you learn, is by being honest with yourself about what works, what doesn't work, and always having that humility as you approach things, and knowing that there's going to be times where you're wrong. So I talked about the generalism already and the clinical approach, and the fact that it's it's just part of what makes us into better herbalists in general, to have that clinical approach and that practical approach to everything we do. And put ourselves a little bit out of the comfort zone sometimes. And then along with that, so to define, my concept of herbal medic is really an entire new world for a lot of people. Then that is what I would consider the auxiliary skills that go into creating a clinic and then to working with people in general. And so that is something we'll talk a little bit about tonight as well. And that is the things that go around actually how do you set a clinic up. And I don't just mean, physically, although that's part of it too, but what are all the things you really need to be aware of, and especially in post-disaster remote? Well, first of all, you're going to need a lot of water, and it needs to be clean water. That should be one of the first things you're thinking about. You need a cover over your head of some type. You need some kind of a roof. You need some kind of floor. You need some kind of a place to be able to see people. You need light. You need, so all of those things start to go into it. You need security. You need to make sure that, that people are coming in a rate that you can govern. You can pretty much throttle up or down depending on how fast you're able to work with them and how many people you have helping you. So and you need to, so there's all these things that go into that people don't even think about. They just, when they start talking about something like herbalism or even like medicine in a post-disaster, nobody thinks about these auxiliary skills, and we'll get into that a little bit. So what are the things in general that we need? What do we need to be able to develop and work with, and what are, if I was just to take a short list and say, and hand it to each of you and say, okay, here's a list, go work on these things. If you want to get better at herbalism for a post-disaster environment, then go work on these things. What would that look like? And this is sort of what it would look like. I guess, so here's your list. There's five items on it, and of course this isn't a complete list, but this is just sort of a high-level 10,000 foot of some of the things we need to think about, and that's environmental. And those of you that just came onto the call, please mute your volume, your headset, whatever you're echoing really bad. So please mute your voice. Thank you. All right, environmental conditions, acute illness, environmental conditions. Let me just stop for a second and say that is all the stuff we would imagine around a disaster or just an environment, maybe not even disaster, but just an environment where we don't have everything that we need the way that we are used to having it. Okay, so that's a huge one, and we'll talk a lot more about that and how in just a few minutes, and how that affects our control of disease, our spread of disease, different types of disease that spread easily in certain types of environments, and how we can minimize that as much as possible. And then acute illness, of course, and assessing acute illness, and then the herbs we would use for it. Acute injury, assessing, and then wilderness first aid is what that stands for, WFA, and the herbs for it. Now injury, when I'm talking about this, I'm talking, of course, non-surgical approach to the injury, not surgical, of course, or anything, or post-surgical possibly. So it could be that kind of a situation too, where it's recovery after surgery. And this is one of my goals with Herbal Medics, is to be able to integrate what we do as herbalists when we go into especially in a remote or third world environment, and be able to have a surgical team behind us by a couple of weeks to be able to come in and deal with the things that we referred because we couldn't deal with them. So we've done that successfully in Nicaragua before, and it works very well. For instance, kidney stones is a great example of that. So kidney stones, and we have portable. If we have portable ultrasound, then we can determine, what size kidney stone is, and whether or not we can help it with herbs. If it's a certain size, there's absolutely no reason why we can't use herbs. They're very effective, 100% effectiveness, pretty much. And then those that are too large that really need surgical intervention, we can refer that. And so that's part of that whole aspect of working integrated with different types of medicine here too, which is one of my big goals. And so that's what I mean by acute injury. But there's a lot that we can do without necessarily having to go in to deal with any kind of surgery whatsoever. And then, of course, chronic, ongoing illness. So there's, as I mentioned earlier, there's many of you who have probably family members who have some kind of, or maybe yourselves that have some kind of a chronic illness, or maybe multiple illnesses in your family or whatever, and elderly and people that are chronically ill, and it could be anything from arthritis, osteoarthritis, to rheumatoid arthritis, to asthma, to diabetes, type 1 or type 2, whatever it might be. And these are things that, of course, you have to really plan for, and these are things that we can certainly give a strong help to as well using herbal medicine. In fact, that's usually where herbal medicine is most well known for its strengths. And then, of course, just being able to set up a clinic, and that also includes just at home. So this is post-disaster, maybe in your neighborhood, that you're the only person in your neighborhood who has medical, has the ability to help people medically. Maybe you have a doctor in your neighborhood, but there are absolutely no drugs available, and there's really not much they can do. If it's a family practice doc and they don't have any pharmaceuticals whatsoever, other than the things that are kind of medic things that they might know and they might be able to do, just basic hygiene type stuff, and keeping things clean, and keeping people maybe even separated if necessary for some kind of an epidemic or whatever. Just the actual having the ability to do something with pharmaceuticals being gone from them, you're actually probably more effective because you are working with herbs that are available to you. You might be growing in your backyard, or you can wildcraft from anywhere in your neighborhood. So all of these things go into that concept of the clinic or the home. So we could kind of go across this and say, okay, let's make a little matrix for ourselves. So what are the things that we really need to do? And the reason I'm doing this is because I think it's important that we not just and I don't know how many of you are taking or listening to me thinking that you wanted to get just a whole list of herbs, and you will get a list of herbs. I got a whole bunch of herbs for you, no question about that. But it's much more than that. Just in the same way that if you're working with as an herbalist, if you're trying to or you're trying to become an herbalist or whatever, you want to work as an herbalist. You probably already know this, I'm sure, that you're not going to just throw herbs at everything. There's lifestyle, there's nutrition, there's an entire a realm of holistic health that goes into it, and herbs is just one small part of that, really. Right? If you have somebody who's been smoking for 40 years and is 200 pounds overweight, you're not going to cure that with an herb, right? So that, and in that regard, if you say the same thing is very true of the acute and of the post-disaster and remote, these are the things that have to be there: water, food, shelter, security, and then of course we would deal with both acute conditions and chronic conditions. But water, food, and shelter and security are the kinds of things that most people don't think about when they think about post-disaster medicine, but they are absolutely as important as thinking about diet and nutrition and lifestyle if you're talking to somebody who's chronically ill because of those lifestyle and diet issues. So it's a very similar analogy. So what are those things, and how would we go about working with that? Well, let's just drill down a little bit through a few of these. So if we're talking about water, for instance, water has to be there. We have to have clean water. And post-disaster, that's one of our biggest problems. Not just drinking water now, not just a gallon a day drinking water that we need, but we need water to keep things clean. We need water to wash out wounds with. We need water to wash away and clean things off so that we don't end up with epidemic problems. That we're working with water for hygiene. And so that means both for us personally, of course, everything that we're drinking. That means if you've ever worked in a post-disaster environment, after even just 8 or 10 hours of doing that, you're just covered. Usually, you're covered in muck. Everything out there in a post-hurricane is covered in sewage and salt water. There may be blood all over the place. There may be there's vomit. There's sewage. There's just there's dirt and trash and dead animals and dead people maybe. And so all of that, as you can imagine, you're going to need to keep yourself, you're going to want to take a shower, right? You're going to need to keep yourself clean too. You have to keep yourself healthy or you're not an asset, you're a liability. So from that standpoint, first, just personal water filtration, the things that we do for our drinking water. But then our team water filtration, we need more for the team. And so usually what will happen if we're doing an herbal medics thing, in a remote country where we have to take care of our own water, then we have to have a detail, or we have to have a group of people, what we would call a detail in the military, to basically work with that. And so, as I'll get into in a minute, we have actual people that's their, that's part of what they do. So that's for our team water filtration for everybody. And we have many, many different ways that we can do that. We obviously want to do the least time-consuming possibilities that we can. And then for community and the clinic water filtration, we've got options as well. And of course, there's many more than what I've listed here. What we usually end up doing is slow sand filtration. Now, that's not necessarily very useful or very practical for large amounts of people. Slow sand water filtration is extremely effective, 99.9% effective. We finish with slow sand filtration, and it's better than the stuff that you're drinking out of your tap right now, I guarantee you. We've even done it without the initial biofilm that has to form. It takes 3 weeks. I have drunk water that is absolutely disgusting. Absolutely disgusting that has gone through a slow sand filter before it's even had a chance to set up the bio layer, which is about, like I said, 3 weeks. Excuse me. And I've never been sick. Never been sick off of anything I've drunk out of a slow sand filter. For people that just joined, please mute your mic, please, on your telephone so it's not feeding back on me. Thank you. Okay, so many of the ways we have to be able to do that for the community and the clinic water filtration, but the bottom line is it has to get done. Okay, and then water storage. How do we actually go about storing the water in a clean place? You wouldn't think that that's such a big deal, but you'd be surprised at how difficult it is to find a clean spot to store your water if you're talking about a post-disaster. And in a post-disaster environment, believe me, containers are king. You need containers like you wouldn't believe. You need clean containers. You need trash. The 5 mil construction grade trash bags those are like gold. Anything you can do to be able to get stuff together and keep it in organized and keep it clean or relatively clean. Keep the sewage off it and the water off it and all of that is absolutely paramount. And so storing your water is something that is just as important and just as difficult sometimes as purifying it. Okay, and then how do we get the water from point A to point B? And usually, the way they do it is just you figure out a good gravity system. You just hopefully have a source that's higher than you need your destination to be, or a way to set that up. Otherwise, you have to pump it somehow. And if to pump it, it's not the end of the world, but it's much easier to let gravity do the work there. So these are some of the things that we go through, in herbal medicine and nonprofit. These are things that we go through. These are things that I went through when I was in the military that I kind of brought out into the world of herbalism and into the world of field medicine, and understanding, that you had to, before you established anything else in a clinic environment, you had to have clean water. So for today, for this, because we don't have a lot of time, and because I'm guessing that most of you are not logged on here to hear about food and shelter and security stuff, because it's not really directly related to some of the herbalism things. But just know that if you came down to our school or you wanted to be on our herbal medics team or whatever, you have to learn this other stuff too. It's just a really important. There's no way to separate it out. But let's move on and let's start talking about other stuff. And first of all, let me talk just briefly about how we would actually do and solve some of these problems on an herbal medics team. We have 4 paths or 4 specialties basically, and this is how these are roles that people get into and work in order to be able to give our team much more flexibility and much more efficiency. And so we have the off-grid engineer, and so the off-grid engineer is basically learning how to solve problems with salvage. It's learning how to make do with whatever you've got. It's your biggest, it's learning basic principles of post and pre-industrial engineering, and then applying those with a minimum set of tools, usually hand tools, and coming up with unique and crazy ways to do stuff. And you'd be amazed at when you take away all of the hardware store, first world kind of luxuries, at how creative you can get, and how creative some of our primitive engineers are. It's mind-boggling actually, some of the things they come up with. It's really cool. So clinic construction, slow sand filter and nitration, and then figuring out how to move water from one point to another. Power, of course, is a huge one, if we can get power. Communication, which is part, if we have power, we have commo usually. And then any kind of construction in general, not just for the clinic, but any kind of construction that we might have to have going on. Then the medic is responsible for the actual running of the clinic. And so everything that we do in herbal medics, and even at the school, honestly, is very focused towards the medic. I mean, the medic is really kind of the head, it's the spearhead of the whole team. That's the entire mission. Every mission we do is in some way related to medicine or self-sustainability of some type. And that could be teaching people how to grow their own food self-sustainably, so that they're growing nutritious food and they're not relying on food that's that's toxic, and that you find out a lot in some of these areas, and not to mention in our own country, of course. Or maybe just having clean water, where you've got a place that the epidemiology of almost 80% of their diseases is related to bad water, whether it's kidney stuff or liver stuff, or whether it's parasites, whatever it might be. But whatever it might be, it always ends up being medical in the end. Okay. And then our hunter-gatherer, which is kind of is the standard, what you think of in primitive skills. You think of the primitive hunter-gatherer, how do you collect food and water off the landscape. But really, it's more the urban hunter-gatherer that we work with on the team, which is sustainability of our food. It's procurement of food from kind of not necessarily completely remote areas, but understanding not just how to procure the food, but how much food do you really need? How are you going to cook it? How do you take care? Actually feeding a team, let alone feeding a community, is a huge undertaking and takes a lot of organization and a lot of skill. And so teaching people how to sustain that kind of source is a bigger deal. And we find that more in the United States, especially underserved urban areas, where that's really important for people to start to get off the grid a little bit in terms of the food that they're eating. And of course, that all comes back around to health as well. But as well as that, also the food and the water supply for the team. And then our scout, which is an incredibly important aspect to the team. It's the advanced party. It is figuring out what we need to do, when we need to do it, who we're doing it for, and what it is they really need. Not what we think they need, but what do they really need. So that is incredibly important. And then along with that, how do we get into an area? How do we get out of an area? What are some of our backup plans if there's any kind of a security issue? How do we, I talked earlier about throttling the flow of people that come into a clinic. You don't want, if you open up a clinic in a post-disaster, you don't want to just have suddenly 100 people storm your clinic and they're all waiting and they all expect to be helped right now. You need to be able to throttle that flow. You need to have something for them to do. You need to have something for kids to do and families to do, and ways for people to be waiting and yet waiting comfortably so that you can get to them, and so that you can actually be much more efficient as a clinic. And the Scout actually helps out with that as well. That has to do just with integrating your team into society. Really, is what it is. Whatever that local culture is. Okay, I'm getting some feedback again. If you are logged in on the conference call, please make sure your headset or your volume, your mouthpiece is set to mute. Thank you. Okay, and let me double check and make sure I don't have any emergency chats coming in or anything like that. Everything's good. Okay, looks good. All right, so where were we? We were down here at the herbal medics, and so the team parts. Okay, so let's move on now, and let's actually talk about what are the specific now on the herbal side, herbalism side, on the medical side. What are some of the things that we would possibly deal with? And so I just wrote down a list for this. This is what I usually teach as being sort of my top, I guess you could say my top 5 or 6 things that I think you need to be really cognizant of. It's not the only things out there, but in terms of acute conditions, if you can deal with most of these areas here or all of these areas, you're usually pretty well. You're pretty well off. You're fairly well prepared. And so these are wounds, and that means open and closed wounds. That means both, a laceration or maybe somebody steps on a piece of metal or something like that, whatever, a perforation, or it could mean even a closed wound like somebody dislocates their shoulder, and then gastrointestinal infections. So here we have anything from viral all the way up to helminthic, so viral and bacterial and protozoan and helminthic. So in other words, parasites, single-cellular parasites, bacteria, and viruses. Those are generally the types of infections that we would get in GI infections. Respiratory infections, the same thing. It can be any of those. Generally, it's either viral or bacterial, but even allergic type stuff, and even chemical stuff, of course, in a bad environmental conditions. Urinary tract infections, much more common in a post-disaster than it is just day-to-day in a first-world environment. Of course, like anything, but it's just there's a lot of hygiene issues, so you get a lot of UTI infections, generally more with females than males. And then wilderness first aid, just understanding how to deal with an emergency situation with people, an emergency healthcare situation, and that's dealing with the immediate shock, the primary survey, secondary survey, how you transport them, where you're going to transport them to. So if you set up a clinic, let's say, and maybe it's just your house and it's a post-disaster, you need to, if everything is completely flattened, let's say like a Hurricane Katrina is about the best comparison here, where there was just literally no higher definitive care whatsoever. In fact, the higher definitive care was more dangerous than just, doing something out of your own house. In terms of what, if you went to a hospital, you might not come out. And a lot of times what you find in a really serious disaster, or one where there's a war at all, like a civil war kind of situation, is that your food, your water, and your medicine are all your killing points. I mean, those are all kind of the choke points where everybody comes in and needs those things, and there's a fight there of some type. There's a fight for control. Hospitals can become killing zones and often do. So that's if we actually have an armed conflict of some type. I'm not talking about just, we had a tornado in Kansas somewhere. That's not the situation. But in Hurricane Katrina is one of our worst examples, I would say, or best examples of that kind of behavior. We had all kinds of problems there. We had decisions that doctors and nurses had to make, horrible decisions with people that were dying, as to what they would do. They had absolutely no way to get any kind of contact or help from the outside world. So, in that case, you're really better off with you're almost better off with working from your neighborhood and working from your own home, right? And so what we would find here, in terms of wilderness first aid and injury assessment, shock management, all of that kind of stuff, is that we are going to have to be able to deal with people not only there, but maybe as we start, this is part of what the whole Herbal Medic Scout site is reconning and finding out who else around you might have a clinic open or has a clinic. And maybe you find out that 10 blocks away there's another clinic that has a couple of doctors, and maybe they've actually got a little area where they can actually do minor surgery. And now when you get people that are coming into your clinic, your neighborhood clinic, you have a place that you can send them. And there's a whole kind of organizational infrastructure that you follow to do that right, and that's out of the scope of tonight's talk. But you have to be able to have a piece of paperwork that follows these people, so that you know where they came from, you know where they went, you have a name, so that when a relative shows up looking for them, you can direct them to the right place. You don't have angry relatives trying to find out what happened to this person who just disappeared at your clinic, and that you can track injuries and you can help people, and you can even follow up on them. That's how you provide good care, is you know what people have, and as a medic, they're your responsibility, and even after you pass them off, you're still checking in with them. I mean, that's I think really makes the difference between good and mediocre. Medic. It's how long you follow and follow up with the people that you're working with. Okay, so the other thing that you need then, I think, that's really important to cover here is the epidemiology side of that, and that just means what are the vectors? Where are our diseases coming in from? And there's all kinds of stuff there in a post-disaster that we have to deal with. Water-related diseases, your Hep A and Hep E and cholera and typhus and things that are related, or even just vector-borne related to the water, like mosquito-borne, because you had flooding, you have malaria now, or dengue fever, whatever it might be. That's a vector-borne, but it happened because of the water, of stagnant water, bad water, that kind of thing as well. Overcrowding diseases, a lot of the respiratory stuff's this way, and you can see a cold or a flu will spread like wildfire if you got a bunch of people packed into rooms, in the basement of a school or something like that, and a couple people are sick or they have some sick kids, and next thing you know, you've got an entire crowd that's sick, right? And then it can get all the way much more than just cold or flu. All right, you can get, what if you had a pertussis outbreak? Like in California, they actually have an epidemic of pertussis, or they're calling it that right now. Or you have a, or tuberculosis, or something like, so things that can be very, very major issues with respiratory type, airborne type viruses and or even bacteria can be a real big problem in overcrowding. So you have to be able to deal with that as a medic as well and think through those types of things too. Okay. All right. So and then we get into chronic conditions, and so I just put in some of the ones that I think in America, in the United States, are the biggest, are some of the biggest issues that we have for chronic disease. And so this is a situation where you just don't have, you have a relative or yourself or whatever, you don't have those medications anymore. You are a type 1 diabetic without insulin. That's a big one. That's not one that we're going to necessarily be able to do. We're not going to be able to treat, quote unquote, something like that with herbs. That's not going to happen. We can manage blood sugar as best as we can, but we're not going to treat. We're not going to have. There's not an herbal substitution for insulin. So but that's management. But that's a worst case scenario. But type 2 diabetes, or just a COPD, asthma, and asthma that's exacerbated by the dust and all the stuff in the air because it's after disaster maybe, and the air isn't as clean as you're used to in your home, or musculoskeletal stuff, so people who are elderly and have osteoporosis or arthritis, osteoarthritis or rheumatoid arthritis maybe, or people that have like a long-term injury that they've been nursing for a long time and it's never really healed correctly, or they have bad arthritis from it, or there's just bad back, slipped disc, those kinds of things, bulging discs, herniated discs, operations on something that they had to deal with that's never really been quite right. So those are the kinds of things you might see too. Diabetes, I already talked about. Psychological is a big one in America. It's a huge one. We have almost 20% of our population, our adult population, is, and I don't know if this is ongoing, if you could say right now 20%, but from time to time, from over the span of the last 10 years, at one time or another, we've gone as high as 20% of our population that is on some kind of a psychological medication. And by that I mean everything from ADHD to depression to PTSD, anxiety, sleep, insomnia type stuff. If you add all of that in, you get about 20%. That's 1 in 5. That's a lot. That's a lot of people. If you take all of those medications away, and granted, not all of them are what I would say are critical, but if you take even if only 5% or even 10, or maybe as much as 10% of them are critical, in other words, people that are going to go massively, they're really going to have a problem. They're going to have a psychological problem. If you remember back to the 4 A's of survival, attitude being one of the biggest ones, and that attitude, I'm here to tell you, attitude is contagious. In any group of people, everything about attitude is contagious. I've seen it so many times it's just a rule of law. It's an absolute rule of the physical universe that attitude is contagious. If fear is contagious, anger is contagious, and so is good attitude, so is passion, so are things that actually get people up and motivated. So that's the good side of it. But my point is that if you have a lot of people who are suddenly off their antidepressants or off their PTSD meds, and that's a whole other can of worms there as to what those even do, but they are off of those, and now they're acting crazy, and it's really not even anything they can control. They're just nuts. They're just going crazy, and add that into what is already an extremely tense and difficult situation, and that's a recipe for disaster. So these are things that we can work with herbs. That's the good news. We can work with them with herbs. So let's go into this now. I guess so this is probably why many of you wanted to get onto this podcast. I'm assuming you want to talk a little bit about herbs, and that's what it's always in the end about, right? Is what are the plants, and what are those wonderful plants that help us? And so I just kind of categorize my herbs that we can go back and talk about some of these things that both the chronic and the acute conditions in relationship to these herbs. And so one of the most important aspects, I think, of herbs that I say all the time, and some of you who are students of mine have heard this probably more times than you want to hear, but it is extremely vital that you learn how to get the herb to the tissue. You can't just use an herb the way you take a pill. You can't just pop an herb and expect it to get where it needs to go. An herb has thousands of constituents. A plant asks your body what to do. A pharmaceutical tells your body what to do, is the old saying that Michael Moore used to have for it, and it's very true. And I think that the secret to being a good herbalist, or one of the secrets, is to not only know an herb, but know the best route. There's many aspects to a plant that you need to know. You need to know the best time to harvest it, to get maximum efficacy off of whatever it is you're trying to get out of it, and that may change depending on what it is you're using it for. It may be different for different plants. You need to know what part of the herb to use, and you need to know how to prepare it very well. That means dry it or tincture it or whatever you're going to do with it, maybe a combination of all of those. And then, most importantly, you need to know how to get that herb to the tissue. So in the case of mucosal vulneraries, time and time again we find they are absolutely phenomenally effective. And a lot of people kind of downplay it and say, oh yeah, it's a demulcent or whatever, a big deal. But it's really effective because of the fact that we're healing the body from the inside out instead of from the outside in. We're allowing our mucosa to heal. We're giving our mucosa the ability to heal. And if it can do that, then we don't need antibiotics. There's no need for antibiotic herbs. It's not that antibiotic herbs aren't good, and we can use them, of course, and that's great. There's times where they're very much appropriate. But if we have a good mucosal vulnerary, a lot of times we don't even get to that point because the mucosa heals. The mucosa is composed of several layers that include everything from the mucin or the mucus to a water layer down to your cilia and the hair, and below that different cells. We've got goblet cells that secrete mucus. We've got cilia cells that actually are the cells that our hairs grow out of, and that cilia beats at a certain those hairs beat at a certain tempo, and that tempo is very important. It's an important, number one, that these herbs beat together in unison, not discombobulated, and some toxins, some viruses and pathogens will cause them to become disoriented and not beat in tempo and not beat together. But basically, that is a very important aspect of that mucosal health as well. And so there are a lot of things that a mucosal vulnerary does to heal those various layers. All the way down to below that, even we've got lymph tissue. And that's basically white blood cells that are grabbing any of the invaders or the pathogens and either working with our memory cells if it's something that we've seen before we need to, or just engulfing them and getting rid of them and doing what our neutrophils and our macrophages do best. It's a part of our innate immune system. All of that's going on in the mucosa. And so mucosal vulneraries are absolutely they're crucial for health around our body, and that's anywhere we have our mucosa. 90% or more than 90%, greater than 90% of every infectious disease that we get as human beings comes in through our mucosa somewhere, whether it's through our gut mucosa, our urinary tract mucosa, our respiratory mucosa, but it comes in through our mucosa. So that's really, really important to know how to deal with our mucosa. If we can help the mucosa and we can get the herb to that location in the mucosa that's under attack, then the rest of it's usually a lot easier to deal with. So some of these fantastic mucosal vulneraries are like our common mallows. Honestly, almost any of the mallow family fits in here, but marshmallow is the one that everybody knows, Althea officinalis. And oh, by the way, and I'm just using common names here, for those of you that are herbalists, and I apologize if you want the botanical names. It's easier to work with, but just to be fast, and I know not everybody here is necessarily gonna want to have to go and look up every botanical name, so we'll use common names. But anyway, the mallows, whether it is the Althea, or the common mallow, the malva, or the licorice, of course, too. Licorice is extremely effective, especially for gut mucosa, very effective for gut mucosa. Prickly pear flower, one of my favorites. I would say, I would go so far as to say it is arguably the best mucosal vulnerary in North America. It's the flower of the prickly pear cactus. So, and it's very, it's a prolific, extremely prolific plant in the Southwest, and even, you can find prickly pear, some species of Opuntia, you could find in just about any of the lower 48 states. But some more prolific than others, and if you can get, the flower and dry that flower, and it lasts forever once you've dried it. It's kind of like having a fruit leather kind of texture, and you can use that as in any way that you would use any other kind of a vulnerary, mucosal vulnerary. So when I say vulnerary, by the way, for those of you who aren't familiar with that word, a vulnerary is just an herb that basically soothes and heals and protects the skin. So that was normally what people use vulnerary for. They say, oh, it's a vulnerary. It's something you put on the skin to soothe and heal and protect it. Like comfrey, for instance, is a great example of a vulnerary. Well, a mucosal vulnerary is something that does that, but it does it to the mucosa. It's much more effective on the mucosa. So all of these are good mucosal vulneraries. Plantain, and by that I don't mean the banana, I mean the plantain and plantago species. There's a couple hundred of those species all around the world, and all of them are usable. All of them are synonymous medically or herbally. Butterfly weed, which is also our pleurisy root. It's many things, but it's also, among other things, it's a mucosal vulnerary. Comfrey, I already mentioned. Comfrey is an incredibly, one of my favorite mucosal vulneraries. I highly recommend using it. I think that if you're going to use it, you probably, in terms of the mucosa and taking it internally, I prefer to use the leaf versus the root. The leaf is not as high in pyrolyzing alkaloids, and there's a kind of a lot of controversy. I don't know if there's a lot, but there's some controversy around using comfrey because it can be harmful to the liver over a long period of use, and that is true if you use it for a long period of time. Mucosal vulneraries we're not using for a long period of time. We're using for a protocol of maybe 3 weeks or so at most, maybe even just a week. So that's not an issue. Slippery elm is one of those it's endangered, not endangered, but it's on the watch list. So I try not to use it, but you can use it. Almost any other elm bark works fairly well, not as well as slippery elm, but fairly well as a vulnerary as well. And then wireweed is one of my favorites. This is a Sida species, and these are another mallow family. You may not be familiar with them, but they are. There's a number of species. There's Sida beautifolia down here. There's Sida acutus, Sida rhombifolia. They're all kind of this sort of insignificant, inconsequential-looking plant that has the typical mallow flower, and they're an amazing mucosal vulnerary. Plus, they're very antibacterial. Highly antibacterial. So I use them a lot for things with respiratory illnesses, especially something where you would have a bacterial infection. And then aloe, of course, is kind of a classic mucosal vulnerary. I don't use it that much, honestly. I pretty much use prickly pear anywhere I would use aloe personally. So these are our mucosal vulneraries, and I think it's really important. I wanted to go through every one of them because I think it's really important whether these, and there's more than just this, of course, but these are really good ones that you have a good in your own personal pharmacy, in your own personal apothecary at home, that you have an entire section of mucosal vulneraries, because you're going to find you use them a lot. Anytime you have anything with the respiratory, anytime you have anything with the gut, you're going to want to generally, anything where there's inflamed tissue in your mucosa, urinary tract infection, even the upper urinary tract infection, you're going to want to use a mucosal vulnerary in there. Okay, very important. All right, good. I'm going to just check real quickly here and make sure that I don't have any questions. Everybody doing okay, it looks like? Nobody's having problems? Good deal. And we'll have a section for, at the end of this, we're going to have a section for questions. So hold your questions till then, but just to let you know, in case you're wondering. Okay, good. Respiratory related, here we go again. And so you can see here, right at the very beginning, I just throw in mucosal vulneraris. And why? Because that's, I'm always going to end up using mucosal vulneraris in the respiratory, especially the upper respiratory. Sinus infections, whatever, man, I'm going to use them. And then some of my favorites. One of my absolute favorites is yerba mansa. This is a fairly new herb for me. I mean, I've known about it for a long time, but I never really have used it until starting about 2 years ago. And then recently, like in the last year, started growing it myself, and I just love this plant because you can use everything from the root all the way up to the leaf, and so you don't even have to harvest the root to use it. And it's sort of like a cross between, I would say it's a cross between something like a pleurisy or a butterfly weed and a golden seal type of plant. Like it doesn't have berberine, but it's got that same feel to it, like a golden seal to an osha root, you know, for anybody who's familiar with osha. So not just for the respiratory, but even externally for wounds. I dry the leaves for like a wound powder as well. Very, very useful and nifty little plant. A butterfly weed we already talked about, but it's and antelope horns is its cousin. So butterfly weed is Asclepias tuberosa, it's a milkweed, and antelope horns is our Asclepias asperula. The antelope horns is more of a southwest Mexico to southwest U.S. kind of plant that you find, and it's I prefer it. I think it's actually more useful in respiratory. Arguably, I would say butterfly weed and antelope horns are the most effective relaxing expectorants in North America. That's my opinion. White horehound, wonderful respiratory herb. Again, another respiratory expectorant. It's actually also vulnerary too. I use it externally for wound healing. It's a bitter for the gut. Lomatium is that's one of these that's a very, very potent respiratory antiviral. Use it a lot for bad respiratory viruses when they first hit. Something that you should think about maybe incorporating. Very similar to osha in terms of its kind of its smell and feel, but I find it to be more potent than osha for that too. And then there should be a comma after osha that's on there next. And then elderflower, of course, respiratory, and probably many of you use it a lot. Elecampane, another one of my favorites. Juniper, we use a berry for that. Juniper is a very powerful antiviral, and it's one of those that we excrete through our respiratory system as well as our urinary tract. So much like garlic, and actually garlic could have been in this list too, by the way. Garlic, if we eat garlic and we have garlic breath for the next couple of days, if we eat a lot, or at least for a day, it's not because it's in our gut, it's because we're breathing it out. It's because it's coming out through our respiratory system. So that's its pathway. Juniper, same way, that's its pathway. So that really helps us a lot with infections in the lungs. So if we have something that's a lower respiratory infection, like a pneumonia or a viral pneumonia or even a pleuritis, something like that, we know that juniper is helpful for us for that as well because of the fact that it's its pathway. It's very antimicrobial. Monarda, one of my favorites, bee balm. It's a mint family and it's very potent for the upper respiratory. Echinacea, echinacea is just unfortunately much misunderstood in my opinion, but just a fantastic herb. It's one of those that should be in one of your top herbs in your apothecary, and I really feel strongly about using the Augustifolia and the Pallida root as opposed to just the purpurea. However, the Augustifolia is somewhat on watch lists and such, so you have to be careful. I grow my own, and if I buy it, I only buy it cultivated. But I know some places where it grows wild and it's very prolific, but you just have to be careful not to overharvest it. Stollentia is also known as Queen's Delight, is a good respiratory expectorant, and then mullein, of course, is classic. Everybody probably has heard of mullein or used it. So these are big respiratory herbs. And then we move on to gut-related stuff. So again, gut, mucosal vulnerary, same thing. Let's get that mucosa healing. Andrographis, a very potent antibacterial for the gut. Very, very strong bitters, called oftentimes what's it called? The world's greatest bitter, or it's got a nickname like that. It's basically one of the most bitter plants on the planet, and I grow it here in my greenhouse, and it's true. I mean, even just a leaf, just take a bite of a leaf, and it's one of those bitters that will not leave your taste buds for for like a couple of hours. It's that bitter, but it's also does all the things that a bitter does. Well, it's also an antibacterial, it's a vermifuge, so it's decent. I use it in my antiparasitic type formulas as well. Something that's very useful to take to like a third world environment like Central America. I use it there for that type of thing too, for any kind of a bacterial gut infection, for instance. Gentian, a great bitter, but not an antibacterial bitter, just a bitter. Gentian has many uses actually besides the gut. One of which is arguably for gential picarin is one of the constituents in it, which is an anti-malarial, which is very interesting. Extremely interesting. It's got some other uses too that are very interesting, but but at the minimum, it's a very good gut herb for as a bitter and as for digestive dyspepsia type issues. Now, I can't get in. I mean, if we get into gut related stuff here, we could talk for hours, for days about all of the different aspects of the gut and what we're trying to do when we're working with the gut. So these are just kind of like a big fat list of herbs that is related to both bitters and chronic issues of the gut that might be related to things like GERD, like gastroesophageal reflux disease, to peptic ulcers with our mucosal vulneraries, to a cholagog for our liver. We have kind of a congested liver related problems with digestion that can lead to things like small intestinal bacterial overgrowth or leaky gut, all that stuff, or what the doctors here would call IBS, which is a synonym for the fact that I don't know what you got. IBS is basically kind of that catch-all. So all of those things could go in there, but also, probably more importantly from a post-disaster standpoint, gastroenteritis. So any kind of an infectious disease, whether it's viral or bacterial or protozoan or even helminthic or parasitic. So these are all, that's kind of what this whole list here is spanning a lot of stuff. So I'm sorry for the fact that it's just kind of like a big pile of herbs here that aren't really very well organized, but that's just to give you an idea. That's a huge spectrum. But still, let me talk through them briefly. Algarita is one for you folks that are in Central Texas that are on this call. You know how much I love Algarita. It's one of our first usage herbs. I would say it's probably our go-to herb for Central America, for Nicaragua, when we start having gut problems. Golden seal also, of course, for the same reason, berberine and hydrostein and a lot of other very active constituents, and just very good for gut health. Oregon grape for the same reason, although milder and a different approach, more for the liver and that type of thing is what I usually use it for. Hops is a bitter. White horehound is a bitter. Gold thread is our coptis. That's it's more of a, came in from Chinese medicine, another berberine-containing herb. For those of you who aren't familiar with berberine, it's a constituent that was found originally, was kind of discovered in golden seal because of golden seal being used so effectively for a cholera epidemic in India, in Calcutta in the late 60s. So this would be something to think about because cholera is definitely one of those overpopulation water vector-borne diseases that you're going to see in a post-disaster environment. You get one person getting cholera, and you pretty much are going to have everybody getting cholera. And it's got a huge mortality rate, especially if you don't have anything to deal with it, because people basically completely dehydrate themselves in a matter of 48 hours. You excrete so much fluid out your bowels that you pretty much are, you dehydrate yourself to death. So golden seal was effective. It shut down an epidemic of cholera in Calcutta back in the late 60s. No other herb, no other pharmaceutical was able to do this. And so one of the constituents that was very effective at that was found was berberine. And so when you hear me saying berberine, all of your entire family of plants that has berberine in them, that contain berberine, the family is called the Berberidaceae family. And that includes things like Oregon grape and Algarita and barberry. And then also you find berberine in other plants that are in other families. But specifically golden seal and coptis in the same family. They both have very high berberine content as well. So this is something that we would use more for infectious disease of the gut, where we had a bacterial infection, perhaps. And even viral gastroenteritis, but certainly bacterial. It's also very good astringent for the gut tissue itself, a very good mucosal astringent and mucosal toner as such for the gut. Burdock, more of a liver root. Dock, more of a liver root. Again, this is digestive stuff. Blessed thistle, same thing. Chicory, same thing. All of those are more liver digestive type of issues. Pumpkin seed, antiparasitic. Black walnut, antiparasitic. Elecampane, very good antiparasitic. And ginger, a very good antiparasitic. Black walnut is also antifungal, a very good one for, usually people who have gut fungus, like they have a candidiasis overgrowth in their gut. There's usually a lot more it's play than this, and we're not going to just get rid of it with one herb. There's an entire spectrum of nutrition, gut health, and probiotics and that type of thing that's going to have to take place for that to happen. But black walnut is a very good antifungal in general for candidiasis as well. All right, whoever just joined in, please turn your volume down or off or mute your volume, because I'm hearing stuff in the background there. It's distracting. Then the same token that we talked about up here, mucosal vulneraries, I think it's very important to talk about the lymph and the immune system. And this is how you keep people healthy. In a post-disaster, remote environment, people start to get sick. We talk about this all the time. This is one of my first lectures I do in my basic course. We talk about lymph health because we say, there's this misnomer out there called the incubation phase. So if you are around a bunch of people who are coughing and hacking on you post-disaster, and you're in you're in that basement of a school or something, and everybody's sick and coughing, and you just know you're sick. You just know that you just got infected. You can tell. And a doctor would tell you, or Western science, medical science would tell you that's ridiculous. You can't know yet, because there's an incubation phase of 48 hours or a week or whatever it might be for this particular pathogen. So you're just imagining it. Well, you're not imagining it. It means you're sensitive to your own body, because that incubation phase is not an incubation phase. It's an attack phase. That's the period of time that your virus has infected your body in some aspect of your mucosa, probably, your respiratory tract, whatever it might be, depending on how that pathogen enters your body, whether it's gut or whatever it is, however it got in. It finds a spot in your mucosa that's weak enough that it can take a hold, and it starts to colonize, and it starts to grow, and it does what it needs to do. And your body's under attack. And if you're sensitive to your body, even though you just got infected 5 minutes ago, you already know you don't feel right. Okay, so listen to those things. Listen to your body, because you're right. So how do we get past that? Well, the good news is we can get past that pretty easily if we can catch it early. With many other factors to this too, besides just that, your rest, your immune system in general, the amount of sleep, your nutrition, all those things that would be under attack to some degree or another in a post-disaster environment is true. But if we can just stimulate and support the lymph and immune system, we can usually get past a lot of these things. Certainly in a normal first world environment we do. Happens all the time. I have students all the time that tell me that the lymph system, the lymph formulas we do are basically a game changer for them, because they don't get sick anymore, because they're aware of their body. And when they start to feel run down, they start to feel sick, they take some lymph formula, before at the end of the day, and they're tired anyway. They're taking that, and they get a decent night's sleep, and they watch their nutrition and their hydration and such, and they don't get sick anymore. So what we do here is we try to stimulate the lymph and immune system to work a little bit harder. And it's not an excuse, it's not a substitute for good nutrition and rest and all those other things, but it is a way to actually jumpstart and kickstart our lymph system a little bit. These work really, really well. So these herbs do different things in our lymph system. Poke, stimulated poke root is what we use here. I'm giving you some herbs, by the way, tonight, that some of them are what I would say are on a very high toxicity level. You have to be careful. Just because you're on this webinar, and this is the first time maybe you've ever even thought about herbs, doesn't mean that it's for beginners here necessarily. I mean, these are herbs you have to be very careful with. So be very careful with them, please. And in fact, I would say don't use them unless you know what you're doing. Some of them, the ones, and I mark them, those ones. Well, poke I didn't actually mark. I guess I should have. Poke is not horribly this way, because poke is self-regulating. It'll make you throw up. So if you take too much of it, you're basically going to vomit it out anyway. Nonetheless, it's not a good herb to overdose on, and it's not that you can easily do that. It's not one of those that's way up on the toxic level, but it is toxic. So you have to take it in smaller amounts. Usually in a formula, I'll put about a half amount or half dosage of that ratio-wise as to what I do with everything else. I never take any of these alone, by the way. All of these herbs we're talking about, almost always in formulas. We're not taking them by themselves. And what that does is that also helps buffer. That helps. There's synergies and there's buffers, and it helps the herbs work better together, and it helps the toxic herbs tend to be buffered to some degree. So poke is like that. Prickly ash, extremely good herb for helping the lymph system and helping open up channels of elimination, especially through the skin. It's a diaphoretic. Diaphoretic is kind of a misnomer. It's not a term that really accurately describes what a skin eliminant does, but that's close enough. So it's a diaphoretic. Blue flag is another one of those. It's high up on the toxic scale. It's a lot like poke. Stimulates the lymph to move. Okay, so you have to be careful when you're using it. It's also actually on a few watch lists in some states, so it's not one of those you want to use too much, and it doesn't take much anyway. A red root, also called New Jersey tea, it's Cyanthus species. That is a very good lymph mover as well. It stimulates the lymph to move. You have to actually almost be careful using it in acute situations because it can kind of hide a problem sometimes, in the sense that you'll feel like you're getting better when actually it's just, you boost your lymph a little bit, but then if you're not careful, and if you don't take it, if you take it in a formula, I don't think this is an issue. I use red root a lot of other ways too. You can use it as a wound powder externally. You can use it in tooth type powders to take care of your gums and help for both gum infection as well as just gum health. Very good herb. Ocotillo is a southwest herb, and that is an extremely good lymph mover, especially for the lower lymph, for the lymph of the lower body. So urinary tract infections, STDs, things where we have the lymph, the inguinal lymph is actually going to be overworked. Yerba Mansa again, that's the same one I talked about earlier, the Anomopsis. It's very, very phenomenal overall herb in so many ways, but one of them is it's a mild lymph mover. Echinacea and boneset are actually white blood cell stimulants. So what they do is they increase the number and the activity of your white blood cells. That's a really cool thing. I mean, it literally within a matter of 24 to 48 hours, triple to quadruple the amount of macrophages and neutrophils. That's pretty phenomenal. Cleavers is a mild lymph mover. Red clover is a mild lymph mover. Queen's Delight, lower lymph again, that's called Stillingia, lower lymph. And then Astragalus is a very mild, more of a lymph tonic that you can use over a period of time. And speaking of time, I don't want to use up too much. I'll just run through a few more here. Genital urinary tract, so these are things that we need. There's an entire approach that you take to urinary tract infections, depending on whether it's an E. coli type infection or whether it's an STD, gonococcal type infection. But in general, bilberry, cranberry, and uva ursi are the big ones there. D-mannose for E. coli as well does the same thing. What they do is they prevent your urinary tract or prevent those bacteria from colonizing. I'm not going to get into it here, but it prevents them from colonizing, from being able to attach themselves to to the wall of the urinary tract and colonizing. Berberine containing herbs there, when you combine them with, berberine doesn't make it out into the bloodstream except in very, very small amounts, like 0.5% approximately. But if you combine them with black pepper, then what happens is the piperine in the black pepper actually opens up the permeability of what's called the brush border layer of your gut and allows more berberine to enter the bloodstream, and it ends up, of course, in your urinary tract. So that's good. Berberine is a very effective antibacterial if you can just get it. Here we go back to the delivery system and the actual pathway. If we could get the berberine to the urinary tract, it's great, but the problem is getting it there. Excuse me. And so the other ones are more like your what I could have put at the very beginning of this actually would have been my mucosal vulneraries. We need those here too. Dong Quai is a mucosal vulnerary as well here. Corn silk is a mucosal vulnerary. Pumpkin seed is a mucosal vulnerary. Nettles root. These are ones that we use too for more like chronic issues that are maybe things like the prostate for males, hypertrophy of the prostate, that type of thing. We'd use those for that. Pumpkin seed and nettles root. Very good for that. And corn silk. Also corn silk and nettles, plantain are good for something where we'd have an upper urinary tract infection. So that's something we have to be careful with juniper berry. And I know there's some people that say this isn't the case, but I've actually had a case where this happened. So I'm very cautious myself. Juniper berry you only use if you know absolutely there's not upper urinary tract involvement. In other words, the renal pelvis right at the base of the kidneys, if that's getting infected or it's irritated, that mucosa there, the juniper berry will exacerbate that kind of that irritation of the mucosa, and it'll cause it'll increase the rate and or the percentage of the fact that you're going to get an infection in the upper urinary tract. So you have to be careful with it. All right, and then finally, wound infection and healing, and this is a big thing. I mean, this is huge in a post-disaster environment. Echinacea is great for any toxic type of wounds. I love using echinacea on the external externally in the body. But here again, Augustifolia and Pallida are what we use, and we use the roots. We're not using the aerial parts of them, and we're not using purpurea. We're not using purpurea flowers. That's a totally different thing. So for wound infection and healing, this is what we want to use. Chaparral, one of my favorites. Charcoal, absolutely a must for your first aid kit, for your herbal first aid kits. Charcoal, that's food grade charcoal, USP grade charcoal, so it's very activated, highly activated, a great way to clean out infections. Lantana, that's one of my local ones that I use here. Nobody else uses it this way. Incredibly good tissue proliferant. Amazing. I've been using it this way for years, and with students and myself, and then finally now with clients too. And I've never seen anybody else using it. And finally, about a year ago, less than a year ago, I saw a report, a research paper that was done in India for this Lantana camara, and they said the same thing. They said it's tissue proliferant. I knew it was. I've been finding that out, empirically with just my own clients and people, students coming through classes that injure themselves and stuff. But it's really good to see it actually on paper finally. Myrrh, of course, is a great antibacterial. Anything with berberine, and I say berberine and MHC, that's maybe beyond the scope of what we're going to talk about here tonight, but just know that berberine and MHC together work really well. And how you get that is you usually get MHC from the leaf of the plant, and it's also sometimes in the root, but in most of these plants that have berberine in them, and by that I mean Oregon grape, I mean golden seal, algarita, barberry, they're usually the leaf of that plant also has MHC in it. MHC basically increases the effectiveness of the berberine up to about 16 times. Not going to get into the details of it. I certainly could, but we're not going to. If you're interested in it, MHC, it's 5'-methoxyhydrocarbon, and it disables bacteria, certain types of bacteria, from being able to eject the berberine out of the cell through what's called efflux pumps. So just know that those two together work much better. The leaf and the root of most of your berberine plants work much better than just the root by itself. Okay, plantain, Baikal skullcap has also, these have Baikal in them. Again, beyond the scope of what we have time for here tonight. Bilberry leaf and astragalus. Bilberry leaf especially, astragalus also, very good for wound healing of all types. Very, very good for that. Increases the vascular permeability and increases more vascularization of the area, and other things too. Wow, I have a whole bunch more stuff I forgot about. Nervines and analgesics. So this goes back to what we talked about with people who are addicted to or have to take medications that are psychological type medications, whether it's for depression or whatever, bipolar syndrome, whatever it might be. And so we're going to find ourselves working with a lot of nervines in that case. They're going to need them. One of my favorites, actually, nervine combinations for people that are coming off addictions to that type of thing is a mixture of skullcap, and by that I mean the Western and Laturifolia skullcap, and Siberian ginseng. I didn't put ginseng in this list, but those two together, if you want to note that for some reason, it works. I've had some really good results with that. Skullcap and ginseng together. And that's Siberian ginseng now, that's not a Panax ginseng, that's the Eleuthero. That's the one we want to use there. Whole bunch more, we could talk for hours and days about different types of nervines. No two nervines are the same. They do different things, different types of nervines. I just want to draw your attention to the Datura in here and to the Gelsemium in here. These are both extremely potent and also extremely toxic. You have to be very careful. Datura you would never take internally, ever, ever, ever. Extremely dangerous. It's external only. But it is an incredibly good pain reliever externally. Even externally, you have to take it very carefully, like rub it on the skin and never on an open wound or anything, just on closed skin. This is like for nerve pain, for really bad nerve pain, back pain, lower back pain, slip disc type stuff, sciatica, that kind of thing. It's absolutely incredible, and it's incredibly good smooth muscle relaxant. But again, you have to take a little bit, and the way you prepare this is in an oil, of course, an oil, and then you put it on the body, and a small amount first, and just make sure there's no negative reaction to it, and then you can use it. And I've never had a person have a problem with it externally, but that's not to say that it couldn't happen. So always very careful with it. Gelsemium, same thing. Just a few drops is all you're talking about there. So I put these on here knowing that this is a kind of a beginner class here, but know that these are not herbs. Once I'm putting in parentheses there, dropwise dosage, cautious dropwise only, that kind of thing. These aren't herbs to play around with. You have to really know what you're doing to use those. But it's good to know what they are. It's good to know them from the standpoint of something you'd stay away from too, unless you know that. So I think it's always good, sort of like learning the dirty language. When you learn a new language, right, you got to learn the dirty words too, so you don't accidentally use them. Or maybe you want to use them, but you don't want to use them in the wrong place. And then the last thing here, I think this is the last one finally, is musculoskeletal pain. Big one. This is a really big one. This is probably the majority of what you see in remote environments and in post-disaster. You see a lot of this kind of stuff. People that are getting injured one way or another, falling, hurting themselves, or just basic chronic pain because they're not sleeping in a bed that they're used to, or whatever it might be. And so these are some different ones you can use for that. I won't go through all of them, but again, these are all anti-inflammatories, and I hate that word because they're much more than that. But they do help inflammation in a number of different ways. Very useful. Okay, so I want to be able to take some questions. That's why I wanted to make sure I had time here. And before I get to questions, let me just tell you, if you download this PDF again, you can get all of these links on it there. But I have an online course that has been a self-directed course up till now, and that's changing. Starting in about 4 weeks on July 15th, it's going to be a very interactive online course. If you like this kind of interactivity, it'll be much more interactive than this webinar has been, because it'll be a small class. But basically, webinars 2 nights a week, assignments every week, and not a lot, but basically the total over 12 weeks is we have a start date and an end date, and there's a final test and everything, and it's got there's about approximately between 1 and 2 hours a week of homework as well. And we're going to be doing tinctures together. We actually I'm sending you the packets of herbs that you'll use. So I'm sending you materials, and then you can use them. You can go through. We can step through everything. We're going to make salves together. We're going to make syrups together, and we'll do that via video cast as well. And then there's a much higher degree of interactivity between the class as well. We'll have some discussion groups and a few assignments that are group assignments as well. So if you're interested in that, that's what that first link is. Second link is my school. Third is my nonprofit, herbalmedics.org. And then I also have, we have Wilderness Herbal First Aid Kits. That's the type you'll never find anybody else selling them this way. I've got trauma kits. I've got all kinds of different formulas. Just knowing what those formulas are, if you're curious what those are, email me. I'm happy to send them to you. I'm not in this for the money, but anything that you buy from the First Aid or from our Herbal Medics site, 100% of it goes to that nonprofit, and it really is great because we can use that for good things. And then the entire the clinical herbalist program itself, you can find at that link there as well, that kind of describes to you that first initial basic 70-hour course, but the entire course is 524 hours. Out of that, 120 hours are clinical hours. We will have approximately 3 clinical hours or 3 clinical weeks every 18-month section starting this fall, and in different places, San Antonio, Colorado, and a few other places where you get literally an entire week of clinical practice. So you can do the whole thing. I'm working on it so that I can actually do the whole 524 hours, both online and integrated with having to come out to the school for a week or a weekend at a time as well, intermittently through that 18-week period. So that way I'm able to try to get the best of both worlds, of both the online for people that just can't make it out here and can't pick up and move, as well as coming out here for small batches to get the things that we absolutely have to do hands-on. The American Herbalist Guild, if you're not familiar with that already, I would highly recommend you check it out. You can just look it up, American Herbalist Guild online. I am forming a new chapter called the Herbal Medic, and that is an interest-based chapter. Whether or not you're a member of our AHG doesn't matter. You can still join the chapter. So you're welcome to do that. And if you're interested in that, then send me an email, sam@thehumanpath.com, if you're not already in AHG, and I'll make sure I get you on our mailing list so that you hear about it and you can join up. We'll be doing probably monthly webinars on different post-disaster, remote disaster, just like this, basically different webinars. I'm going to do some first aid stuff, some wilderness first aid stuff. We'll do all kinds of herbal first aid stuff. The founding members that I'm pulling in with it to begin with are going to be Stephen Horn, who was president of the AHG for about 7 years. Thomas Easley, some of you know him. He's come out to teach at my school. Incredibly good herbalist from Alabama. I've got Seven Song. Will be a part of it. Got a few other very key players down here in locally that are my more advanced students that are part of it as well. So we've got some great herbalism, and it's going to grow like crazy once we get it up and running, and that starts in about a week. So if you're interested in this post-disaster stuff, and you're not a member of AHG, send me an email, and I'll get you on that mailing list. And then I've got a recommended book list, so just to give you more resources. And then if you have any questions about classes, email my wife. Usually is a better way to get the answers quickly. If you email me, you might not know I might not get back to you as quickly as I wish I could. Always pretty busy. So, what else going on here? You guys have any questions at all? Then type them into chat, please, and we'll all right. What is the botanical name for wireweed? That is Sida. Okay, so wireweed is Sida. I'll spell it out for you. Sida is the genus, and the species is Butifolia and acuta, and also Rhombifolia. Those are three of the most known ones. Those are the three species that I know of real well. Juniper for lower UTI only. That is absolutely correct. Lower UTI only. Lantana, how do I use it? I use lantana externally only. Now, I have used it as a steam inhalation for respiratory illness. It works really well. It's actually a great respiratory herb that way, but it's one of those that's very near the high scale of toxicity. So we've got you have to be real careful. I really would recommend not using it internally. That includes even an inhalation, but when I've used it, I've been very impressed with it. And I know a forager, a guy who writes books on foraging, who eats the berries if he cooks them and de-seeds them first. He says they're fine. But normally they tell you, if you read any like agricultural information, they're going to tell you don't touch lantana because cows eat it and die, basically. But externally only, but you can put it in an open wound. I put it in an open wound, and that's how it works. It's an analgesic, it's an anti-inflammatory, it's antimicrobial, and most importantly, it's a tissue proliferant. And so I use it actually raw, squeeze the leaf up till it's just about pushing out a fluid, and then put it on there. And burns too. I put it on burns. Works really well. And then just tape it down for just a couple hours. You don't want to leave it on too long, but a couple hours is about all it really takes. And then with the lantana, it's the leaf, not the flower. With the yucca, I am not talking about yucca. No, yucca. I'm talking about actually yucca, like yucca. Like we have twist leaf yucca and Buckley's yucca. Even the sotol is actually a type of yucca too, and it's the same family, in the agave family. So not the yucca. The yucca is an actual root, kind of like cassava or like a sweet potato out of South America. Totally different thing. Thank you, Karen. Yeah. So Karen's are saying that it worked for her well too, the lantana. I had one of the most skeptical students I've ever had. He's an emergency medicine doctor out of Austin, and he's actually a military doc too. And great guy, awesome, amazing guy, amazing doc. But he was at one of my classes, and he tore up his hands real bad. He skinned them up real bad, just kind of like real deep abrasions on both hands. He fell on some rocks. And so he came to me and he says, like, okay, you know what? I'm willing to put aside all skepticism because I'm in your class. So what would you do for this? So I gave him a bunch of lantana. We bandaged his hands up for lantana just for the night, basically. And the next morning he came out to me and he said, oh, my God, I'm sold. I can't believe this. What is in this stuff? So, I'm telling you, there's something to it. Now, not every lantana species works that way, though, in my opinion. The Camara does for sure. The urticoides, I think, is another species. The ones that seem to work really well, because there's hundreds of species of lantana. It's more of a tropical plant all around the world. And the ones that work the best have a really deep, skunky kind of smell. They're like a skunky mint. All right. As I'm talking about the different herbs, what goes on in our area? Yes, Emily. So, yes, absolutely, Emily. If you have any questions specifically in our area, meaning Emily's talking about Central Texas, and so, of course, our algarita and our lantana, and we have a different kind of plantain here, but we've lots of that. We have prickly ash here. So there's so many things here in our area. I have a book for anybody in Central Texas, South Texas, or Southwest USA. I have a book that's a field guide, not a field guide, a field manual, and it's on that same link that I sent to show you where you buy the first aid kits at. You'll see that book there, too. I have another book that I'm going to be finished, I hope, by the end of this summer, and that will be a much bigger book. It's called The Herbal Medic, and it's going to be not just a field manual, but a much bigger book that will have a much bigger materia medica on it as well. So that will be available by then also. All right, cool. Other questions? Anybody else have a question? It's great to see a lot of you guys here. I haven't seen you forever. I think there's probably 30 or 40 people here that are old students of mine that I haven't seen for years. So hi to all of you that I haven't talked to for a long time, and thanks for coming out and being in on this. I'm going to be doing more of these webinars, a lot more of these webinars. And like I said, if you jump into that Herbal Medic AHG chapter, then that's probably your best ticket into getting, not just from me, but people like Seven Song and Stephen, Horn and Thomas Easley. All of them really great herbalists, so you'll be able to kind of get the best of everything in that. I have to kind of organize it, but we'll get it organized up, and we'll have a whole different selection of different topics that we're running through over the course of any given year. All right, well, thanks, everybody. I don't have any other questions from you, so have a nice night for the rest of the night here, and we'll talk to you later, hopefully. Bye.